Welcome to the MPI Sports Symposium. Today I'm going to be talking about golf and the shoulder and trunk connection. We're going to talk about a lot of different things that relate from all the way to the hips to the shoulders. I understand that the foot, ankle, and the knee and the elbow and all that stuff plays a part of it. To be concise, we're going to dive into those areas. This particular video is going to be broken down into a few different sections. We're going to talk through this a bit, and then we're going to go into some functional testing that you can do in your office. Then we're going to go into some swing faults that you could look at on video to really try to help make that connection between the swing mechanics and the injury and your treatment plan. And then we'll wrap it up with some more information. Right out of the gates, I want you to understand that this is going to be a lot of TPI stuff, but at the same time, there's going to be other aspects of it. And being a MPI doc really gives you a leg up compared to other therapists that are doing the TPI screen. Level 1 TPI is a lot of different types of fitness people, golfers, doctors, but having your skill set is going to be able to really make a difference for golfers in your community. And the good thing is no matter where you live, golf is probably being played. It might be seasonal. Down here it's year-round, but it might be seasonal, and it's a really good target audience for you. And I'll talk a little bit towards the end on how you can kind of network in that and grow your practice for golfers as well. But the majority of this is going to actually be clinically related. And I look back at one of the questions that was asked at a TPI level 2. So I'm TPI certified through level 3, and even back in the day, they had a golf biomechanics class, which I really enjoyed, and that was a lot of 3D analysis. But a question was posed to Dr. Greg Rose about how come in TPI there's no treatment methods taught. And it was a good answer that he gave. Essentially, he can't expect to be able to teach chiropractors how to do manipulation, how physical therapists to do this, that, and the other thing. So they try to teach you how to assess, understand golf injuries, the video aspect of it, and then you apply your treatment skill set to that. And that's going to be the same thing for this video as well. You're going to have a different skill set than maybe your colleague, but if you can understand how to assess golf injuries, you can apply your manual skill set and your treatment to that. So I'm not going to dive into a lot of that. I will make reference to where some good motion palpation and manipulation will be beneficial and give you a leg up to other folks. But we're going to really just go into screenings, assessments, and some correctives, okay? One of the things I want to touch on that gets a little bit confusing, but is it's very instrumental in understanding how the body works during golf, and that is the 3D kinematics, or the kinematics of the golf swing that TPI teaches. And it's really understanding the pelvis, torso, shoulder, and arm. Okay, so in that you have to understand that the pelvis needs to start the golf swing, and then the torso follows, then the shoulder and the arm. And so some of the questions I'll ask a golfer when they're a patient of mine is things like their handicap, because you're not going to be able to get their 3D analysis most likely unless you're working with some really high-level golfers. It's really difficult to get that. Now, I was fortunate enough for a few years to be working with Florida International University, and they had the whole setup. I was on the research, so I've done a lot in this regard for the 3D analysis. But I just want you to know that this is going to be kind of the blueprint of someone's swing. It doesn't matter what their backswing looks like. It doesn't matter what they look like. If they have a really good 3D kinematics of the swing, they're going to have really good power development, and they're going to prevent injury. Because what ends up happening, and I'm going to show some of the swing faults there, is if you get into this golf swing here, you'll see a lot of golfers from here will start to swing with the upper body, and that's going to cause a lot of shoulder issues. And you're going to deal with that tug-of-war battle all the time between you treating them and them going onto the golf course and not getting the results that you want. They're going to re-injure themselves. So really what you want is from here, you want the pelvis to start to swing, then the torso is going to come through, and then the arms come through last. And so when you watch a really good golfer, that pelvis is already rotated quite a bit. And it's kind of that whip analogy you'll hear is the energy is going to transfer from the lower body out to the club and really generate a lot of good power without putting stress. So the arms and the shoulders really should just follow. And so understand that kinematic sequence is going to be important in the golfer. And so many mid-handicap or high-handicap golfers, they're out of sequence somewhere, right? They may start it with the torso and then the pelvis goes, and then the shoulders. They may start it with the arms. That's very common in high handicaptors. So I like to ask those questions of the golfer and just say, okay, what's your handicap? How often are you playing golf? Do you have a teaching professional you're working with, which is going to be part of what I talk about later on, connecting with golf pros as well. But you want to start understanding where this golfer's probably talent level is. And then if they have video of your swing, with technology now is great. You can get that video. We use Spark Motion to assess when we need to, but there's a lot of different things out there where you can assess the video. And I'll go over some key things to look for when it comes to the trunk and the shoulder when we go through that, okay? The thing that I really find exciting about working with golfers is a lot of times you're trying to put this puzzle piece together. And so you might have a golfer with shoulder pain or a shoulder injury, but it could be because of the low back or the pelvis. Or vice versa. You could have a golfer that's got a lumbopelvic issue and pain, and that's what they're coming to you for, but it really could be a shoulder issue. So we're going to figure out how that works and show you some things to really work through that in today's video. So just to kind of summarize what we're going to go through, we're going to show you how to assess the pelvic mechanics. You can obviously add some motion palpation to that and adjustment, and then we're going to work our way up from probably the hip joints all the way up through the shoulder into the elbow a little bit, and then understand, yes, foot and ankle and all the other parts of the body play a role in it, but for brevity we're going to handle those areas and try to give you an understanding of how the body's working in golf, and then you can apply your other assessments and treatments to that golfer. Typically in my office I will run through a SFMA to get a general screen going, but if it's a golfer I'm going to then dive into some golf specific testing. Before I do that I will run through evaluation of the hip joint, and I'll do other things too, but for the sake of this presentation I'm going to check the internal and external rotation of the hip joint. I don't need to show you that, you know how to do it, but with golf you really want to make sure you get about 40-45 degrees of hip internal rotation and at least 55-60 degrees of hip external rotation. It's going to be really important for the golf swing, because if they can't internally rotate that right hip on a right-handed golfer, it's going to set up for a whole lot of other issues. Now if you think there's significant arthritis and degeneration in there, that's something I'll let you handle clinically, but we want to have good range of motion of the hip joints. Without that, it's going to be really difficult for the low back, and then that's going to work its way up to the shoulder. For here, we're going to try to figure out the pelvic mechanics. I mentioned that kinematic sequence, that you really need that pelvis to function. And what's interesting about that, they've done a lot of analysis of it, and the pelvis is going to do quite a few things during the swing. So if this golfer is facing that way and it's a right-handed golfer, and this is their pelvis, they're going to be set up in a little bit of an anterior pelvic tilt. But as they as they go into their backswing like that, they're actually going to go into even more of an anterior pelvic tilt. So there's going to be some tilting anterior of the pelvis. But then as that pelvis starts to rotate towards the target, there's going to be an ab crunch in a sense, and it's going to posterior pelvic tilt as it's rotating there. And so if that golfer can't do that smoothly, it's going to chew up the low back and cause all kinds of other issues from a performance standpoint as well. So these three tests that we're going to go through right now are going to help us see how fluid that is, and it's also going to allow us to see how their X factor or X factor stretch is. And so I was fortunate enough years ago to do a little bit of work with Jim McLean down in South Florida. He's located down here, and my office was down there, and he came up with that term, the X factor. And then subsequently, other people called it the X factor stretch. The X factor is just the difference between the rotation of the pelvis and the torso. And so they really want to get about 45 degrees of the pelvis and 90 of the shoulder, and so that difference would be 45 degrees, right? 90 minus 45. But then the X factor stretch is where now we're at 45 and 90. They're going to start that pelvis like we mentioned. That's that X factor stretch where it could be at 40 but then increase before the shoulders follow. So these tests are going to help us see if they can actually do that from a motor skill and then maybe even from a physical limitation. So we may need to kind of sort through that a little bit more. So I've got Chris here. He's our scratch golfer, right?
Yeah, something like that.
And we're going to work through first the torso rotation test. So I'm going to have him get into golf posture here. So good like that. I like to have the shirt tucked in so I can see the belt buckle. We're going to see how all that is going to move. And what I want you to do is actually just rotate the torso without the pelvis moving, okay? So you'll have them do that, back and forth, backswing and follow through, and you can see he's getting a little bit of pelvic motion. So if they do it, great, they pass, we move on to the next one. If we see there's some rotation in the pelvis, we're gonna get into here. I'm gonna block his pelvis like that and have him do it and just see if he actually has the mobility to do it there, right? So the differential there is, can they do it? That's plenty of stability with mobility. If I then hold their pelvis, because that was moving, and they can't really get good range of motion, then we have a mobility restriction in that situation, okay? So we want to see how that looks to see that differential there, okay? The next one is we're going to actually do the pelvic rotation test, which is going to be the complete opposite. We're going to keep this upper body here, just like that. Good. And now what I want you to do is just rotate the pelvis. Good. He's doing a little bit of the shimmy right there. So what you'll see a lot of times is it's not pure rotation. It's a little bit of this going on there, or they can't do it all. So same thing, I'm going to go in, go off posture. I'm going to hold up here. Good. Now I'm going to have him do it. And it's still a little bit off there. Not terrible, but not great. You can see there's a little bit of side to side. Good. But he can do it. He's got the ability to separate the two, which is important. But we could probably work on the coordination a little bit in there. And so there's some drills. A lot of it's just getting in front of a mirror and having them do that. So some of these are drills to work on the motor part of it, the motor control part. Some of them are actually correctives, and obviously there's performance training that can go along with it as well. Okay, the next one is going to be the pelvic tilt test. We've all heard about pelvic tilting and do that, but we're going to do it in the golf swing. So we're going to go ahead and face that way, just like that. And what I want you to do now is from there is just under, yep, and then go the other way. Good, we got the shake and bake going there. So as I mentioned before, during the golf swing, we're going to have some anterior and posterior pelvic tilting happening in the swing. And so we want to see how that is. And you can just notice when he goes into a posterior pelvic tilt, there's a lot of shaking that's happening there. Good. So you can imagine if that's happening, or sometimes you'll be surprised they can't do it at all. They have no coordination in doing that move. You can imagine what that's going to mean in the golf swing and how that pelvic rotation is going to be. And so from a corrective exercise standpoint, I would probably start someone that can't do it at all in a supine position and just work on the basic pelvic tilting and get that going. And then work themselves up to, like with Chris, I'd probably have him doing that consistently in the golf swing and just try to work through that a bit. I get a little bit of the shake and bake, but not as much as him. I've demonstrated this for about 15 years, so it's been part of my practice. So that is the pelvic and, we'll call it the lumbopelvic mobility testing that we're going to run through just to see how they're doing. And then you can apply a lot of your motion palpation to the area to see where the joint restrictions are and give some correctives. When we get to the swing faults, I'm going to show you one called early extension, which is a very common swing issue. And it's a lot of times a combination of a tight hip flexor and weak glutes. And a lot of our golfers, what do they do for a living? They sit for work. That's just very, very common. And then they go to the golf course and bring their dysfunctions to the course. And so I really want to make sure you test hip flexors and glutes, however way you want to do it. I'm going to show you a couple options here and then how that's going to relate to the golf swing a little bit later, okay? So, Chris, I'm going to have you go, we're going to do Thomas test first. I'm going to have him sit on the very edge. I think a lot of you have seen this. I'm going to have you grab that knee, yep, and go all the way back. Good. Then I'm going to get into here. And you can see this is just kind of popping up a little bit here with the hip flexor. So a little bit tight there. And a lot of times I'll just press down. You feel that stretch there? Yeah, you'll feel that. And sometimes this leg's kicked out a little bit, so rectus femoris is probably a little tight. So here I would definitely say he's a little tight in the area. And so the hip flexors are going to be a concern. I would test both sides and see what that looks like. And now I want to see what his glutes are going to be doing. And I'll explain to that later on in the swing. So let's go all the way back there for me. There's plenty of ways to test glute function. I'm just going to show you one. If you got other ways to do it, great. We're going to do the single leg test and see how the hamstring and the glute is firing together. So let's go ahead. We'll actually use this leg as the plant leg. Go ahead and go into, let's actually go a double glute bridge to squeeze the glutes. Bridge up for me. Good. Go ahead and cross the arms. Good. Now what I want you to do is extend out this leg and hold. Good. Perfect. I'll have them hold that. I want to get in a good plank. Good. Things I'm looking for is shaking, not being stable. If this hamstring cramps on them, they go down right away. We know there's an issue. And I just want to see how they do with this. Pretty good. Good. Right, come on up. And so that's a glute bridge test that they do in the screening, and you can see if the glute's functioning. You can also do hip extension test, which is a great one, but there's other ways you can also assess the glutes and the hip flexion. But make sure if your golfer has a shoulder injury or a low back issue, you're checking hip flexors and glutes as well, and I'll show you how that relates to the golf swing in a little bit. So now we're going to work our way up to the thoracic spine. I can't stress the thoracic spine enough in the golfer. I'm going to show you some things in the swing dysfunction category as well that show up with it, but you really need to make sure there's plenty of extension and rotation in the thoracic spine. That's going to cause a lot of low back issues and shoulder problems if it's not happening. If they have really, C posture that we're going to talk about, it also can mess up the scapular mechanics as well. So I want you checking scapular mechanics, right? I'm not going to go over much of that today, but it's going to be very important in this process. But I want to definitely show you a few things for thoracic mobility that'll help. And when you pair this up with your motion palpation, it's just really lights out. So make sure you're doing that in your seated scan as well. But we're going to show you 3 things right now to assess how this is working in the thoracic spine. The first one we're going to do is the overhead extension test. You've seen this plenty if you do the SFMA. When I did take my training through TBI, was actually fortunate enough to be with Greg Cook, and he went through that whole thing. So whether you've taken SFMA independently, TPI, DNS, there's a lot of great things out there that work with golfers. It doesn't have to be just one. So however you may assess the thoracic spine is fine. But we're going to show you 3 right now. So just going to have you go ahead and stand. Good. Feet together for me. Good. Standing tall. And just go ahead, arms overhead, and extend back. So this is the one where you've seen, are they getting any extension in this here, right? He's getting a lot from the low back. You can come on up. And just a little bit limited right in through there. Great little screening that I'm probably going to have to tease out a little bit more. That's just a top tier SFMA. You'd break that whole thing down. I'm not going to go through that today, but I really like that one just to see what they're doing from there. Then I'm going to do the overhead squat test. This one could be broken down a million different ways, but I want to, just for the sake of this, I'm going to see what he's doing with an overhead squat. Okay, I like to have a nice dowel rod, get into the squat position there. Feet shoulder width apart. I want the feet straight. I want that overhead there, and I'm going to have you go into a deep squat as far as you can. Good. And come back down. If the golfer can get all the way down with that over the head, we're doing good. A lot of times you're going to see them come forward, and that's going to be a problem. So go ahead and show what that would look like. And yeah, you'll see most. That's how I look. Actually, I'll show it. I'm the perfect problem child on this. I can get all the way down, but when I go to here, I can get all the way down, but the heels. But for me to do it, my arms go forward. I cannot keep it up over there. I've got terrible thoracic extension, even though I work on it. But that is a good example of someone that gets all the way down, but they don't have the thoracic extension to handle that. So that's going to be part of what your screening would show from there. So that's going to handle really the extension component of it. Now we're going to do a nice, easy half-kneeling rotation test. That's really good. You may have some palpation and other ways of checking thoracic rotation, but this is a really good one for the golfer. And this is going to rule in and rule out scapular and low back excessive mobility when we do this. So we're going to get the golfer into a kneeling there. And if you have a dowel rod, you can use a golf club. It's great. So you just go ahead and hold that in front of you, just like that. Perfect. So you get the golfer in half kneeling. You have them cross there, and you could have a goniometer out, but you can really just eyeball it. You want to be able to have them rotate, and you can use the rod as kind of your measuring stick there. And you want to see if they can get at least 60 degrees opening up that way. Chris does really well with this, and that's good. Okay? Now what we're going to do is we're actually going to slide this. We're going to lock in those scapulas. So I'm going to slide it, right in, get that up into there. Nice, good posture. And then we're going to rotate again. We're going to see. If we notice anything like more than 10 degrees of a difference on here, we got a problem. They were compensating with the scapula and the low back. And he's doing pretty good on here. Okay? And so that's a great way to see if they have, go ahead and stand up, the thoracic mobility to handle the golf swing repetitively. So you saw earlier we did the torso rotation test to see how their mobility was and also stability. And on here we're checking thoracic mobility, ruling in and ruling out lumbar spine and scapular mobility to make up for that. I think one of the things you can do in your practice that separates you from anybody else that's working with golfers is if you take the time to understand the golf swing on video analysis. Most likely you're not going to have access to 3D analysis to check that whole kinematic sequence, but if you can explain that information to the patient, that's going to help you. But there's no reason why you can't assess video. It's so easy now for people to get videos to you. When I have a golfer and they've got a video, I ask if they have a video. If they do, I have them try to send it to me. It's not that I assess every golfer's videos, but if they do, I really try to take the time to do that. And I try to look for certain things because it's just really interesting to me how this whole thing works out, and really also communicating with their golf pros. So if they have a teaching pro, if you can communicate some of this to the teaching pro in a way that's not trying to show that golf pro you're the expert in the swing, but that you can speak the same language and that you understand that connection of it. Because part of the thing we'll see is, just an example before we get into it, is like, let's say that I've got a golfer that comes in and they've got low back pain, right? But I'm doing all my assessment and I realize they've got all kinds of shoulder range of motion problems. I didn't run through a lot of shoulder screenings. You can do all that, you know how to do it. But you've got this golfer with severe issues with external rotation of the right shoulder. But their teaching pro doesn't really understand that. And that teaching pro is trying to get that golfer to get into a position in their swing that they just physically can't do. And so they're causing a lot of problems with their low back. And so I'm going to show you one right out of the gates called the reverse spine angle that happens because of that. So let's envision golfer can't get to like 100, 110 degrees on external rotation normally. And so that golfer's trying to get his club to be in a certain way. And so what ends up happening is, if that teaching pro is telling that golfer, I need your club to be in a certain plane on the top of the swing, but they can't physically do it because of here, they're going to go into a reverse spine angle to get there. So since I don't have the mobility to do it, I'm going to side bend like that. And that's going to chew up my low back. And that's an example of seeing that on video, pairing it up with your shoulder assessment and saying, oh yeah, you have shoulder restrictions on this right side, you're going into a reverse spine angle, let's try to work on that. And you can communicate that with the teaching pro. And so that's an example of what's so important with understanding the swing and how it can affect this whole puzzle you're trying to put together. So that's why I like doing that. And the reverse spine angle is one of those ones that I see a lot of, where you look at it and there's a shoulder restriction causing a low back pain. I see it on video. If I don't clean that up, or at least explain it to them, then it's going to be a tug-of-war battle that's going to be tough for you to win. Okay, so again, the reverse spine angle is going to be from here. They take the backswing, instead of really planning here, rotating around there, getting a nice spinal rotation. And again, if they have lack of thoracic mobility, that's going to be a problem as well. And they just tilt to the side like that. It's going to also cause some left low back pain. And then ironically enough, as they come down here, they're going to have this excessive kind of crunch on the right and come through there. I see a lot of golfers with right-sided low back pain because of that reverse spine angle as well, and a little bit of an excessive crunch factor happening there. So if you see that on video, could be a shoulder restriction, could also be causing some low back pain. So that's the reverse spine angle. The early extension swing fault I mentioned earlier, where it ties into the glutes and the hip flexors, is one where I'm going to show you from the side here. And golfer comes back here, and when they, instead of, you could, if I had a post right here, and you can actually do a drill where you have a club shaft right there, and during the swing they should stay on that the whole time. Well, what ends up happening in the early extension is they come up off it and through, so they're extending towards the golf ball, which is a kiss of death, whereas it really, they should be able to sit back and rotate and come through here. Well, when the glutes can't stabilize and function and the hip flexors are tight, it's going to cause some of that. And then that's going to cause low back issues, terrible ball striking, so that's a whole other story. But it's also going to cause shoulder issues here, because if I come to here and then I early extend as I'm coming through like that, I've gotten my hips into that slot where I need to come through, and I'm going to alter my upper extremity a lot to try to make ball contact. So I'm going to have a lot of excessive movement that I'm trying to make up for it. You get real handsy with it. You get a lot of elbow issues, big time problem with that. So make sure they're not early extending. That can cause a lot of shoulder issues as well. Very, very common with that one. Now let's get to one of the ones on just address, right? Like when they address the golf ball, are they like that, right? This is going to be your poor posture, your C posture. And when they get to there, they're obviously not going to be able to get the range of motion they want from the shoulder. So if they're in that C posture, they really are going to have altered biomechanics of the shoulder and decreased performance there. So I always look for their golf posture on video. I can do it obviously in the office too, but a lot of times whenever you check someone's posture, as you know, or you're doing that, they'll get really good. But when you get them on the course and actually swinging, you'll see the reality of what their golf address posture is. And if you see that C posture, it clues you off to, okay, we might have a thoracic mobility issue. If we've got that thoracic mobility issue, we might have a scapular stability problem, and then works itself to the shoulder. We've all seen, I guess I shouldn't assume, right? But we've seen that alternating mobility and stability. I think that was the Gray Cook thing, where you need good hip joint mobility, you need core stability, thoracic mobility, scapular stability, shoulder joint mobility, elbow stability. It basically alternates like that. So when you see that C posture right away and you've got a lack of thoracic mobility, you're going to start seeing that through the chain. So check out for that slouch posture there. The other one is going to be a very accentuated anterior pelvic tilt, and they call this S posture in TPI. But if they're like that, that's going to really throw off all those pelvic mechanics we talked about with what it needs to do during a backswing and fall through there, and it's going to have a high crunch factor on the low back. So if you see a posture like that, you're going to be concerned with a lot of low back issues there, okay? So that's something to look out for as far as posture goes, okay? This next swing fault that I'm going to show really is the biggest problem when you see shoulder issues with golfers, and that's over the top in the golf swing. You know, if you're treating a golfer and evaluating with a shoulder condition, this is where you see a lot of the impingement syndromes and torn rotator cuffs, and even labral issues. So over the top is really going to be that they're out of sequence. We talked about earlier in the kinematic sequence, pelvis, torso, shoulder, hand, club. That's the sequence you need. This over the top, you can see it on video, is where they really start with the arms. And that's just going to look like from here, go in the backswing, you'll see it look like that a lot, right? They start the swing with the upper extremity, and it's just going to take so much strain, torque, and undue stress on the shoulder and arms, and it's going to cause all kinds of performance issue on the golf course as well, but it's really going to lead to their shoulder and elbow issues. I would say this is the biggest problem we see with shoulder injuries in golfers, is this particular swing fault. You want to know if they're doing it. If they're doing it, you need to communicate that to the patient, because if you're treating the shoulder and they're going and play golf two to three times a week like that, it's going to be a problem. So check for that over the top. Explain that to them. If they've got a teaching pro, that's a great opportunity for you to talk to the teaching pro and where you think that's causing the issues with their shoulders. So look for that over the top. It's very, very common, and it just wears out the shoulder, right? It also wears out the elbow. You know, a quick little note on the elbow. The elbow is usually a reaction site. If someone's dealing with elbow issues, there's probably a shoulder problem, okay? So you want to address that in the golfer. So if they come into you with some kind of golfer's elbow, make sure you're checking everything that we did today, including the shoulder, and then see if they've got this over the top swing fault, okay? Last one is a flat shoulder plane, where again, we're going to go through here. In a good golf swing, you can see how I'm bent over, my shoulder's at an angle. You want to maintain that. What happens in a flat shoulder plane is as they take a backswing, they flatten the shoulders like that, because they can't set the elbow in like that and get the external rotation they need, so they flatten out a little bit. And so if you see that in the golf swing as well, that could be something to clue you off to a problem with the thoracic mobility and the shoulder mobility there. So that's how you can start to kind of marry the swing fault with your physical assessments and their pain and injury. And when you put that together, it gives not only you a clear picture of what you need to do to really help this person, it gives them a clear picture. And they feel like they've gotten an experience that's second to none, and they really are on the path to fixing this thing, especially if they're going to be an avid golfer for many years. So that's how you can really pair up your assessments with joint motion palpation and your manipulation with the physical assessments and obviously corrective exercises to help out these golfers. If you make this connection for them, it's going to really do well for you. And understanding that when the golfer comes in with these issues, you got to look at the whole body and start to really give them solutions, not just for their shoulder, but also for everything else, or not just for the low back, but for the whole picture there. So make sure you're doing that. So now we've done the whole thing with assessing the golfer and putting that puzzle together. There's obviously a ton of information out there on this. If the golfer interests you, you're going to see him even if it doesn't in your practice. So I highly recommend understanding these concepts. And then from a standpoint of positioning yourself in the community as the expert working with golfers, I highly recommend you connect with trainers, personal trainers, obviously teaching pros, and start to form that team in the community that's going to help with your patients that are golfers, whether it's referral based, like if you get the golfer that needs a teaching pro and you have someone, or vice versa. It's very good to have that team around you. That's something that I've done in my community to target golfers, not only in the content that we've produced over the years, but also in the connections we've made to do that. There's many different certifications and trainings to learn how to work with golfers. This is just one that I'm certified in through TPI, but I've also applied a lot of what I've learned throughout the years from Motion Palpation Institute, active release technique, what have you, to really put it all together. But just start to understand how certain golf injuries work, what's causing them on the golf course, ask the right questions of your patients, and you'll find yourself positioned well in the community as a golf injury expert. I hope this was helpful for you. If you have any questions, feel free to ask me. I do a lot more than just marketing for chiropractors. I've done a lot with golf. I've had tons of fun doing it over the years. Been fortunate enough to work with a lot of different levels of golfers, and it's a fun patient base to have in your clinic.